Welcome back to Sage Connections. Today's episode is one I've been really excited to bring to you. We're diving into a topic that doesn't get talked about nearly enough with nuance, honesty, and real education. Tummy Tuck recovery and true core rehabilitation. My guest today is Lisa Marie Ryan, co-creator of Tummy Tuck Rehab. Lisa is a former competitive CrossFit athlete, coach, and pregnancy and postpartum athleticism specialist. And she also brings the deeply personal perspective of having gone through both diastasis recti and a tummy tuck herself. Together, she and her colleague created a program that is changing the way we think about surgery, recovery, and what true rehabilitation really looks like. Whether you're a patient considering surgery, someone in recovery right now, or a clinician wanting to better support your patients, this one is for you. Enjoy. So, you started out as a high school English teacher and then became a competitive CrossFit athlete and then moved into pregnancy and postpartum athleticism. Can you, that's quite a journey. Can you kind of walk us through your personal story and what
Yeah.
ultimately led you to Tummy Tuck Rehab?
Yeah. High school teacher, super passionate about that. For many years. I kind of figured I wanted to do that towards the end of high school, even like just really felt like that was my thing. And then somehow, so basically my husband got a different job in California. We were long distance for a while. We actually got married and then I moved out there. And so I left my teaching job here that I absolutely adored. It was very hard for me. It was very good for me in a lot of ways because it was good for me to get away, right? Because I grew up here and it was just a really good experience. But at my time out there, I ended up at a gym with very competitive CrossFit females specifically that were CrossFit Games athletes. And, I think CrossFit competition finally just started around 2007 was like the first year of that. And I moved out there in 2009. So it was just starting the birth of all this stuff. And I had been CrossFitting a very long time because the CrossFit that I was out at here, Hyperfit USA, was one of the very first CrossFits. And so I'd been CrossFitting a very long time. And so everyone kind of looked at me and were like, you're going to do this competition stuff. And I was like, what? And I just got roped into this and it was just amazing experiences, amazing people, did a lot of things I never thought I could do and really just kind of life-changing stuff. Um, and so when, few years of doing that and all that. And then finally I'm like, great, it's time for kids. I'm ready for a break from all the stress. I'd work all day and I'd train hours at night and it was really great. But it was like, okay, now I felt like it was starting time to like start a family. And so I got pregnant. And then back then, so Chase will be 12 in March, which is my oldest. There was not much talk of pregnancy and working out and all this stuff. There was like one blog that was like, oh, don't do sit-ups in second trimester. And I mean, there's just nothing out there. And so I didn't really go crazy doing anything during that pregnancy, but I also had no guidance. I just had no idea. And I just spent the whole time really being paranoid about, oh my gosh, I'm going to lose everything. I did all these amazing feats and I competed and I did all the stuff I never thought I would do. And now, oh my gosh, I'm going to lose it all. And I was just like so panicked about it, even though I was ready to have a kid. And everyone's like, oh, you're going to bounce back, all the stuff you hear, you're so fit, da, 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 right? And so I had him. And basically, the long story short, because I go on and on, once I lost the weight, because I gained a fair amount of weight with Chase, and I still had this protruding belly, and that was like at like 7, 8 months postpartum. I had no idea, like not a clue what was going on, and I was like lifting heavy. I was doing everything, and I didn't necessarily even feel that bad, which is another interesting thing. But I somehow finally diagnosed myself. My hand basically, like once I tested myself the right way, my hand just fell into my stomach. Like it was just, I was like scared shitless. I was like, oh my God. And my husband was leaving for a work trip the next day. And I like was like in tears that night. I was like, what is this? So then I like stopped doing everything at CrossFit, which was also really traumatic. Tried to get to the bottom of that. Found a therapist that helped me the best she could. at the time, kind of like did some things and then kind of got back to working out again. But knowing that I had this thing. Then so all of that started happening back here. And I left my other teaching job and I was kind of just at home with the baby, which is also an interesting transition. I was very grateful to do it. Don't get me wrong, but it's interesting when you're used to teaching and working and doing all this stuff, right? So in the midst of that, I'm looking for any information I can find about this, right? And you're hearing all this stuff. Don't do this, like all the stuff 12 years ago, and just horrifying. And then I'm like trying all this gentle stuff because I'm like, oh, this is supposed to help. I mean, that wasn't going to do crap for me. I was already so strong, right? And so it was just really bad. So by the time I got pregnant, my second is when, so Brianna Battles, who created Pregnancy and Postpartum Athleticism, I get in contact with her from Lindsay Valenzuela, who is another CrossFit Games athlete friend from California. Her sister knew Brianna and she was going through weird diastasis stuff. And so I had posted something about it and she was like, hey, text this person. So I text this random person back in California after I'm back here living in Michigan because we moved back when Chase was like 4 months old. And she's like, so we're just like talking. I mean, back then Brie didn't know anything either. We're all just like trying to find all this information. And so she starts to find more stuff. She creates her company. I kind of am following along with her. She's like, okay, this is what, this is what you're going to do your second pregnancy. So, I had some more information, but I mean, I had a very, very severe diastasis. Like it is what it was. But that after that pregnancy is when I started my business. So, she really pushed me to do it because I was like, oh, I need a babysitter. She's like, get it now. Anyway, I got a babysitter for my younger one who wasn't in preschool. And I just did it. And it was probably the best thing that I ever did because it healed me by helping other people. And it also started, something for moms here that like wasn't here. Right.
Yeah.
So that was kind of the birth of my first business. And so that was in 2017 or 2018. Yeah. Right. 2018. And then I felt like I was helping people. So I felt very fulfilled, but in a part-time manner, which took the void from not teaching anymore, right? Which was great. But then I knew all along this that like, okay, I think surgery may be in the cards for me. But after my second pregnancy, I really wanted to rehab as much as I could, get as strong as I could before going that route. And so during that time, that's when I was talking to like Munera and Anthony and Brianna a lot. And a lot of people were helping me. I had a therapist here, Nancy Boyd, who was there. I mean, I think I found her at 6 months postpartum with my second son. And she was phenomenal. I mean, she was just working with me and like trying to get me back to doing things I want, knowing I had this and figuring out together and open and just amazing. And, then I'm like, okay, great. So I've kind of navigated this, but now I have to navigate this damn surgery because I'm like, I want to get back to doing all the things I want to do at the gym, right? Like I hate the way the stomach looks, but I also want to be functional. So it was really scary because you go into plastic surgeons and plastic surgeons aren't focused on function because their art is their plastic surgery. It's not bad. It's just that's their art, right? And so then I had to feel like I had to find a surgeon that understood me. It was really hard for me to trust anybody. So that's why I'm really passionate about helping people in these consults. And we have like lists of questions on the Tummy Tuck Rehab page because I want people to really do the research and find the right surgeon. But then that ended up being the birth of business too, that I co-founded with Munera, because I wanted to give people help with recovery and like, sure, you've got exercises and things to do, right? But it's also so psychological with what you're going through on this in many different ways that I just felt so passionate about helping people with that because I feel like 2 times in my life I've been on these journeys and it's been scary and I felt like at times there was nobody that could help me. And like, it was an awful feeling. So I just don't ever want people to feel that way. Like I want something there to help them, whether it's pregnancy and postpartum, whether it's diastasis or recovering from that, or if people go down the tummy tuck route, tummy tuck, because tummy tuck is stuff people are talking about even less. Pregnancy and postpartum has gotten so much better, which is great. But the tummy tuck stuff, people are like embarrassed. They want to talk about, it's a whole different level. And it's even more of a issue of missing information in that realm than pregnancy and postpartum. Part of that is Brianna's done a great job in that space with people that want to lift heavy and do those types of things and, all of that, which is great. And so that has gotten better along with all the PTs and everything that everybody that's so passionate about this now. And so it's so good. But the tummy tuck thing is weird. So that's where I'm like, all right, we're going to niche down one more. I still work with my pregnancy and postpartum athletes, but niche down more to really help these tummy tuck people, whether they're, and with that, it's like whether they're a high level athlete or somebody that, wants to just, I don't know, move with their kid pain free or whatever. It's all not the same, but the going through that process can be equally as terrifying. So it really, really can. And so that's where I've gotten passionate about helping people with that. So
That's great. Yeah. I mean, I think there's still a lot of, not just with tummy tuck. I mean, there's the tummy tuck and then there's like the full mommy makeover and
yeah,
all that stuff. There's
yeah,
still in our culture, there's still kind of shame around that,
for
right?
sure.
Like,
Yeah,
oh, plastic surgery, oh,
right.
and so, we have to understand that sometimes that tummy tuck is very functional because what happens when you have that diastasis recti, and this can happen in men as well. I mean, I think
Yep.
we don't we kind of um, don't talk about that enough, but
Yeah.
high level weightlifters,
Yeah.
if they're, now, sorry, I'm jumping around a little bit, but yeah, I just want to kind of touch on the fact that there is sort of shame around that
For
still. And
sure.
I hope that we can, if not with this conversation, then with a lot of the other, sort of content that you're putting out, that we can kind of mitigate that shame.
Yeah.
Um,
100%.
but being a CrossFit athlete, do you feel like there was any conversation around pressure management? Um,
Not back then. I think now people are, kind of learning more and more. And I think there's more men that are invested. Like I know all the people at the gym, at my gym at CrossFit Email are obviously great. It's a great gym as it is, but they're always wanting to learn and the guys there are great and just so good with the female athletes. I think that's getting better and better. Um, but in general, it's not always, I don't think we're at the point where everybody just knows it either. Right. And it's not the end all be all. Like it is great to set your pregnancy up. I love working with pregnant athletes and giving them strategies to feel like they're controlling what they can. They can manage the pressure. They do what they can, but depending on how birth goes or what their genetics are or whatever, they can't control a lot of what's going to happen. Like what happened to me was not because I did CrossFit. It was because I honestly didn't push it that hard during my pregnancy. It was just the cards that were dealt to me. I had a huge baby. I got a small torso, and then whatever genetic components with my fashion, whatever else, who the heck knows?
right.
I didn't feel that way at first. I didn't know what to feel. But there is a lot to that too. It doesn't mean to just throw it all in the wind and do whatever you want during pregnancy. Who the hell cares, right? But there is a lot you can't control. And I think we want the answer that we can control everything, especially the type A, very competitive athletes. They want that. Okay, what do I need to do? I'm going to, but the reality is you just can't, right?
Yeah. Yeah. So, okay. So your mission with Tummy Tuck Rehab is kind of to
Yeah.
change the conversation around
Yeah.
tummy tucks and move away from the quick fix narrative. In your ideal world, how would surgeons, therapists, patients talk about this surgery differently?
Yes. So I think what you said, there's a lot of shame that goes along with it. A lot of, I know like PTs, and they don't always mean to, but it's good to strengthen first. It's always the best. It's always the best way to go. Strengthen, conservative first, see what you can do on your own because you'll go into surgery stronger. So you can't lose. Sometimes I think there's a lot of the language that I think is harmful is that, oh, I failed PT or no, no, you just are a surgical candidate. That's all. You're a surgical candidate. You are someone that surgery may be right for you. You may still not even choose to do it. Did I need surgery? I mean, did I need it? No. I was really strong, doing a lot. I mean, my fascia was so thin, they thought I had a hernia and I didn't. As I got older, is that kind of a risk? My organs are kind of falling out. Probably not good for me. I don't know. At the time, I was fine. So, yeah, there's some like long term health parts to that probably aren't healthy for me, but I was fine. Um, do I feel stronger now? Yes, in certain things, certain exercises I do. So that is good, but I think that if they could frame it more of empowering women to make educated choices, right? Empowering them to get strong and then make their decision. Because sometimes women will come that really don't need a tummy tuck, right? Or I may look at that woman and be like, oh, this is going to be a person at risk for not being happy after surgery because they don't have an extreme case. And that's something we can talk about too. But, and it's easy to just want to be like, what are you talking about? But instead, I think framing it in the way of, all right, well, we're not going to do that now, right? Let's get you as strong as you can first. See if there are aesthetics changes that you're happy with. Even if there aren't, you will be in a much better place physically to go through in a surgery. Plus, you want to be, so far out postpartum, like hormones are re-regulated, fascia is truly done healing. That could take a year or two, like all of that stuff, right? You really want to set yourself up for like the best possible thing. And so I think that's the best way to approach it without being shameful, whether it's someone that you think, oh man, they really need surgery, or, oh, they really don't, whatever you're thinking in your head, because that's normal to think. But if we could just send them on the road of either way, we should do this first. Some people will just rush into the surgery. There's nothing you can do. It's their choice. As long as you present them with that information, then you can feel good at night
Yeah.
that you tried,
So let's go back. So who is the best candidate for a tummy tuck, and how
Yeah.
far out should they be from pregnancy?
Yeah. Yeah. So I say, and this is not, I know Munira is Miss Research, so she has all the research, but I personally would tell people to wait at least a year before getting surgery. I was longer. I was way longer than that. So Dean was like 2, something like that. I'm pretty sure there is some science behind it. Can be up to 2 years for your fascia to truly get as strong as it can. Do you know offhand?
Yeah.
1 to 2?
So actually, so we have about 14 months
Okay,
for that
cool.
for that
14.
to
Okay,
close. Yep.
cool. All right, cool.
And but I just was wondering if you guys found any new research, because I
I
know
don't think so. It sounds similar.
yeah.
Yeah.
Yeah,
And I mean, honestly, getting a surgery with a 1-year-old is really hard too.
right.
That's why I was also it was taking me a long time. So I was really trying to get strong and
Hmm.
wasn't ready and da 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 da. But Dean was over 2 when I had gotten mine, and much easier to, not have to pick him up, all of
Right.
that kind of stuff. And that's a big deal. Now, if you have a ton of help and that stuff isn't a big deal, then that's different, right? But you have to take that into account too.
Yeah. Yeah. Well, and especially, something I touch on as a physical therapist is, most people are concerned with the how wide the separation is.
Yeah.
But what we're really looking at, the sign of sort of health and resilience when we're talking about diastasis recti is actually the activation of muscles underneath,
Right.
right?
Right.
So we have that time to bring the gap close, but I don't care as much about that as I care more about the firmness.
Right.
How many,
Yeah.
like you said that at a certain point you could put your whole fist,
Yeah.
it's because
Just
yeah,
all the way.
yes,
Yeah.
right. And I bet it felt squishy and
Yeah.
yeah,
Yeah.
yeah.
And
And
that didn't change. My
mhm,
muscles got stronger, but that fascia area, that was done.
right, right.
Yeah.
And so you're right. I mean, I hope physical therapists are not telling people they fail PT. I
Right.
mean, I
Right.
have heard that, they failed pelvic floor PT in other places.
Sure.
I don't like that language
Right.
because it doesn't serve any good
Yeah.
purpose.
Right.
So, but yeah, I think I hope that we can change the language as practitioners
Yes.
this to not shame people, but we are sort of the co-pilot. We're just there to educate
Yeah.
and to bring as much awareness and to help people make educated decisions when it
Yes.
comes to their health and their bodies,
Yeah.
and not necessarily, exert our own opinions on what they should or shouldn't
Right. And
do.
it's hard. It's very hard sometimes
Yeah.
because, um, because you are, like I said, you're going to think the things in your head, but then just reframe it when you
Yeah.
say, because what's worse is if you scare someone off, then they may just jump in and do surgery even sooner, right? Because they're just like, oh, well, screw this, I'm just going to, and they might jump into a surgeon that isn't as good, or they may regret getting it, or, all of that stuff. So that in my head, that is my biggest goal, is navigating people before they make the big choice, helping them navigate that in a really healthy and informed way, which often does not happen. And
Right.
I get a lot of people seeing me later that are upset about X, Y, and Z. And so that's what Munir and I really want to change.
Yeah. So, having gone through this procedure, can you talk about kind of how you felt? I mean, I think everybody, not just women, but men go through abdominal surgeries as well.
Mm-hmm.
So I think this can be very applied very broadly.
Yeah.
How was it? How did you feel? How long did it take,
Yeah.
to feel normal again?
Yeah. It's the thing about abdominal surgery is the core is your life. Like, it is literally like everything you do is your core, and you don't even realize it until you get the surgery, right? You hurt your foot, you got crutches, now I'm not saying that's easy. I'm just saying literally breathing, moving, going to the bathroom, like it is really, 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 really hard. Like really hard. And I do think it gets downplayed a little bit. Oh, 6 weeks, da 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 da. If these, plastic surgery places, and it is a big flipping deal. Like, I will say it over and over and over. I'm not saying don't do it. This is not me being negative about surgery. This is like, these are the facts. Also, the facts are it may be months before you feel better. Everybody's recovery is drastically different. I've worked with people where at 8 weeks, they're like, let's go. I'm going to squat. I'm going to, like, they are, and other people that are like hunched over still. And they're like, what is going on? And both had good surgeons. Nothing was wrong with their surgery. Nothing went wrong. It's drastically different. And again, also does not matter how fit you are, because I was pretty fit. And I feel like my recovery was not the most extreme, horrible, like end of that, but it was definitely not on the easy end at all. So I had a little bit harder, I think, of a recovery in general. And that's what my surgeon told me. He's like, I can't tell you how this is going to go, which I really appreciated because I just want honesty. And if you don't know, tell me you don't know. Don't just make something up, right? So I think that is the biggest thing I want people to know, is how hard the surgery is. You need to take it very seriously, and you need to take recovery very seriously. Get yourself set up away from kids, if you have kids, away from big dogs, away from whatever you have, so you can truly rest, especially in those first 2 weeks where you're really not supposed to do much at all, to walk around. And you don't do some knee-jerk mothering thing because a kid's there and it's just hard not to, right? So you have to be really strict with that recovery in the beginning. And I think that's the biggest thing overall when you're looking at any kind of abdominal surgery.
Right. Yeah. And I mean, you're also dealing with kind of the drainage part of it,
Yep.
right? Like,
Yeah, for
you
about a
know,
week.
for
Yeah.
about a week, right? So you have all these kind of attachments to you for a little
Yeah.
while. Yeah. And then you have to think about scar tissue on the
Yep.
back end, because sometimes that scar tissue can pull on fascia and cause more sort of symptoms down the line, perhaps low back pain. I mean,
Yeah.
I've worked with women who, they come in for low back pain, and then halfway through their their sessions, they're like, "Can you look at this scar in my abdomen?" And
Yeah.
I was like, "Yeah, yeah, of course." And then we'll work on that. We'll work on the
Yeah.
abdominal fascia, and their back pain, decreases significantly. So,
Yeah.
so I don't think there's enough emphasis on that either.
Yeah. Oh, yeah. I mean, the scar, most tummy tucks are hip to hip. So you have a huge scar. If you had C-sections, they'll normally just use, they'll kind of, I had C-sections. If you didn't, fine. But if you did, so then it's another scar on top of a scar,
Yeah.
you know. all that. And so you have to think about that as well, right? And then you have to think about with recovery, some people are hunched, some people aren't. So that's going to kind of blow up your back for a little while. And then even when you're feeling better because you're a little hesitant with your core, you tend to get back pain because you're kind of scared to use your core. It's a long process of figuring that out. Again, some people kind of truly have it pretty decently easy in recovery. Those people run the risk of overdoing it. I had a client who went back to squatting pretty quick because she felt good and she had all this pain and back pain. I just did a month with her. We did some core stuff, some rehab, some strengthening, just some things to kind of reconnect and re-strengthen, and she was good to go. Right. So it doesn't have to be super complicated, but jumping right back to it without like really getting your mind to connect back to this area, which will be a little numb. It's literally a new stomach. Like your muscles are in a different spot in your body. Like you can't just go back to doing what you're doing and you think everything's going to work the same, right? You just have to give it, you just can't rush it. You have to give it the time, build the foundation, connection, all that stuff. And then you can go back and it will be great. But you have to honor that even if you have an easy recovery.
Yeah. So when somebody is picking a surgeon, can you give us, 3 to 5 criteria that somebody can look at
Yeah.
when picking a surgeon?
Yeah. So the biggest thing is the board certified because there's a lot of cosmetic surgeons that are not, they should not be doing tummy tucks. So you have to make sure they're board certified. So that's the first thing with the credentials. Then you want to look at their experience. So how many tummy tucks have they done? How long have they been doing it? I think those two things are really, really important because that way they have the experience with different bodies and different things. After those things on paper, those are all great. Great reviews are all great. You can read these great reviews, but you need to go in there and connect with the surgeon. You have to. You have to, because you have to be able to ask questions as you think of them after you leave, because you're going to think of them later. You have to be able to communicate after if you're afraid of something or scared, or you also have to, and you have to trust them because once they get in there, if something looks different, they may have to change something that they have to do. So do you trust the doctor to do that? And those things are going to come from consultations and interviews and asking questions. It's very hard for women oftentimes to feel comfortable spending time asking all the questions and then later thinking of more and going back, and you have to do it. Set another appointment, figure it out. Don't short that process. It's emotionally draining. It can be financially draining. Sometimes they're like $100 to go in and do that, or it depends. It is overwhelming. It takes time. We're all busy, but I can't say it enough. You really have to spend the time interviewing those surgeons.
Okay.
Yeah.
So lastly, I just want to ask from a coach's lens,
Yeah.
what are some of the biggest mistakes you see people make when trying to return to
Yeah.
fitness after tummy tuck? And I suppose that depends on the sport as well, but just in
It
your
does.
area
Yeah.
specifically.
Yeah, it does. I think there's a couple things I think, and sometimes, the surgeon will be like, just ease back into it. And you know what? For some people, they just do it on their own and they ease back into it and they're fine. So again, it's a spectrum. In general, I feel like people feel, especially runners like, oh, I'm just running. Okay, I'm just going to start running. And running has a lot of, okay, have you re-strengthened a single leg, right? Have you connected back to your core? You're running, right? All of that stuff, doing some intentional core exercise before that, I think can pay off dividends. So I see that with runners. And then people that are lifting weights, same thing. It's like, okay, well, I'm just going to lift this. I'm not even front squatting, I'm back squatting. So it's fine. You're still using your core. And if you don't trust your new core yet, then you're going to rely on your back or something else, or you might have other aches and pains, or you may get an injury because you're just not relying on your core the way you should. But if you start, and this is my most favorite thing to do, is really starting slower than you want to, is really what it's all about. It's with running, with weightlift, whatever you want to do, swimming, whatever you want to get back to, you have to start slower than you want. It will pay off. I've been saying in my own personal business for years, as slow as fast. but it will pay off if you just slow down in the beginning, work on foundational stuff, put on lighter weight than you want the first time you're lifting. Um, do a lot of volume at a lightweight when it comes to lifting. Okay. Um, you know, People that are used to doing a strength cycle with like squats and deadlifts and all that stuff, it's not going to look like a typical strength cycle when you start. You're going to be doing, again, lower weight, higher volume for a while just to rebuild. So in general, those are the things I like to say when people are thinking about, okay, how is this return to fitness going to look for me, depending on, what people like to do for fitness. But it goes across the board, go slower than you want to.
That's great advice. That's great. And hire a coach, a PT, somebody that
Yes.
can be there with you who's seen this before and who can cue
Yes.
you appropriately, especially in the beginning, because it's really hard sometimes to have self-awareness,
Oh,
even if,
totally.
yeah,
Yeah.
even for people that are professional, sometimes it takes an
Mm-hmm.
outside eye
Yep.
to make sure that you're set up correctly so that you don't get injured,
Yeah. I
So,
mean, I wouldn't have done without Nancy, and I worked with Anthony a little bit, low, and I was terrified to do my first like modified Howell hold. I will never forget this. It was one of the first sessions with Nancy. She's like, "All right, Lisa, that's time." I was terrified. If I didn't have someone helping me, I think me personally, I would have been kind of stuck. Other people, it might be that they're going too fast. But wherever you are on the spectrum, if you have a PT or a coach, and that's why I love coaching people, like especially when I can see them in person, because I do a lot of remote tummy tuck, one-to-ones. But when I get to see someone in person, it's great because then I can feel their stomach. I can look, oh, it's so great. Because it is truly an art because you're looking at the person in front of you, what they did before surgery, and then you're helping them return to whatever they wanted to do. It is pretty individual, right? Definitely programs can help. So for my own personal business, I'm actually releasing a return to functional fitness after tummy tuck. So it's very, very specific to that kind of program. Um, for people that like to, go to CrossFit gyms and do that kind of training, street parking in their garage or whatever they're doing, very specific to that. But in general, again, same thing, like with our core rehab program that we have at Tummy Tuck Rehab, that's for any athlete. So high level athlete, the exercises in phase 4 are really hard. I was sweating when I was like filming them. They were really, really hard. But the beginning, everyone starts at the same place. So that's where I try to remind people, whatever they were doing before, everybody starts at the same place. You have to figure out how to breathe and open your stomach again because it's super tight. You know, that's step one. That's before you even clear. Oh my gosh, can I breathe? I mean, it took me forever to be able to take a full breath. So that's what you're working on first. And then you're starting with very gentle exercises because you're seeing if you can connect back to your stomach that's numb and like weird. So, you've got to get that core rehab in, whether you're a runner, a weightlifter, swimmer, tennis, golf, whatever you do. You have to get that core. That core rehab program is at the heart of everything because that will set you up for much better success in anything that you want to do because that's your foundation. So
awesome. Thank you so much. This was so informative. And I think, like I said before, I think this can kind of go across all genders and
yeah,
all sorts of abdominal surgeries,
yes,
hernias. We can talk
yeah,
about all that kind of stuff, but this all applies. So thank
yeah,
you for sharing this.
yeah.
And we will definitely share all of your information in the show notes, so people can get a hold of you. So
Cool.
thank you so much.
Yeah, I love helping. Thank you.
Thank you so much to Lisa Marie Ryan for this important, eye-opening conversation. Thank you for the work you're doing to bring more honesty, integrity, and true rehabilitation into a space that's often oversimplified. For everyone listening, we'll link all of Lisa's information for Tummy Tuck Rehab and her educational resources in the show notes so you can learn more and connect. As always, thank you for tuning in to Sage Connections. If this episode resonated with you, please share it with someone who might need to hear it. As always, until next time, take care of your health and your wellness.